everyone, I am Dr. Ekta Bhushan, teaching anatomy and physiology, physiology of exercise and sports medicine at Indira Gandhi Institute of Physical Education and Sports Sciences, University of Delhi. I welcome you all to online lectures of CEC-UGC. In this series, we will discuss different topics associated with sports medicine, but today in particular, we will discuss the topic ultraviolet rays therapy. So, have you ever wondered why, by looking up at the sky and thinking about what causes the deep blue color? Or you may not realize, but electromagnetic waves play a major role in this. Electromagnetic spectrum is the combination of radio waves, microwaves, infrared waves, visible light, UV light, and also X-rays and the gamma rays. So the interesting thing is electromagnetic waves travel through the empty space and it travels very quickly. Ultraviolet light therapy is the use of ultraviolet light to destroy infectious organisms or harmful cells that cause disease of the body, especially superficial lesions and skin infections. Ultraviolet light is naturally emitted from the sun, but it can also be channeled for treatment with special designed devices. Light has different wavelengths. The wavelength most commonly used in the therapeutic ultraviolet light treatments are longer wavelength UVA light and shorter wavelength UVB light. So, several mechanisms are involved in medical ultraviolet light treatment. Ultraviolet light can damage human cells, both healthy cells and harmful cells. It is believed that the therapeutic effects are due to inducing an oxygenated reactions that may preferentially destroy certain cells, such as the autoimmune inflammatory cells seen in lupus. Ultraviolet light is also germidal. This is why it can be used to eradicate some infectious organism on the skin. So let's look what is ultraviolet therapy. So ultraviolet radiations, we also call them UVR, has been an effective treatment for a number of chronic skin disorders, and its ability to elevate these conditions has been well documented. Although non-iodizing exposure to ultraviolet radiation is still damaging to deoxyribonucleic acid and integrity and has a number of unpleasant side effects ranging from erythema, that is sunburn, to carcinogenesis. As the conditions treated with the therapy tend to be chronic, exposures are repeated and can be high, increasing the lifetime probability of an adverse events or mutagenic effects. So, despite the potential detrimental effects, quantitative ultraviolet dosimetry for phototherapy is an underdeveloped area, and better dosimetry would allow clinicians to maximize biological effect whilst minimizing the repercussions of overexposure. So this review gives a history and insight into the current state of UVR phototherapy, including an overview of biological effects of UVR, a discussion of UVR production, illness treatment by this modality, cabin design, and the clinical implementation of phototherapy, as well as the clinical dose estimation techniques. Now, several dose models for ultraviolet phototherapy are also examined, and the needs for the accurate computational dose estimate method in ultraviolet phototherapy is discussed. So let's look into the types of ultraviolet therapy, ultraviolet rays, and you can see in the picture there are three types of rays. One is UVA, UVB and UVC. We can see that UVA and UVB can reach to the earth, and UVC is not able to reach the earth because of the ozone layer, and there are different types of wavelengths. So selection of dosage level for ultraviolet radiation. So there are different types of dosages. We have divided, that is E1, E2, E3, E4, and E1 given to the body area, and E2 may not be given to 20% of the total body area. E3 may not be given to up to 250 centimeter of normal skin, and E4 may not be given to an area up to 25 centimeter square of normal skin. Now ultraviolet A, long UV and penetrates to dermis, responsible for development of slow natural tan. Then UVB, medium UV, erythemal UV, or produce new pigment formation, sunburn, vitamin D synthesis, and responsible for inducing skin cancer. Then UVC, short UV or gamedical UV, and does not reach the surface of the earth. Now let's look into the types of UVR generators. So the first one is mercury vapor lamps, and it can also divided into two, which is air cooled medium pressure mercury vapor and water cooled mercury vapor lamps, and the second one is fluorescent lamps. So let's look into the mercury vapor lamp. A mercury vapor lamp is a gas discharge lamp that uses an electric arc through vaporized mercury to produce light. These are used for the production of ultraviolet rays for therapeutic purposes. The first mercury vapor lamp was invented in 1901 by American engineer Peter Cooper Hewitt. Then the mercury vapor lamp can be of two types, air cooled and water cooled medium. Air cooled mediums are medium pressure mercuries, and water cooled mediums are also medium pressure mercury lamps. Then the next one is fluorescent tubes. One of the major problems with the mercury lamp is that it produces a certain proportion of short ultraviolet rays. So modern treatment regimes often require the use of long wave ultraviolet without the short wave, and so various types of fluorescent tubes have been designed. So the spectrum of each tube depends upon the type of phosphor coating. Each tube is about 120 centimeter long and made up of a type of glass that allow long wave ultraviolet to pass. So the inside of the tube is coated with a special phosphor. So a low pressure arc is a setup inside the tube between its end by a process of ionization similar to the described for the mercury vapor tubes. Short ultraviolet is produced, but it is absorbed by the phosphor and re-emitted at a longer wavelength. Depending upon which particular phosphor is used, the output of the tube may be part UVB and part UVA, that is 280 to 400 or UVA 360 to 400 nm. As in the PUVA apparatus, but accurate control of the emitted wavelength is possible. Now, Therectin tunnel. So, the Therectin tunnel is a semi-cylindrical frame in which are mounted 4 fluorescent tubes. Each tube is mounted in its own reflector in such a way that an even irradiation of the patient is produced, allowing the treatment of the whole body in 2 halves. Normally, fluorescent tubes with a spectrum of 280 to 400 nm are used. Then, PUVA apparatus. For the treatment of cirrhosis, where a large amount of UVA is required, the fluorescent tubes are used. The tubes are usually mounted in a vertical battery on a wall or 4 sides of a box surrounding the patient. This forms a ultraviolet is usually given 2 hours after the patient has taken a photoactive drug such as the Sorolin. Hence, the term PUVA is Sorolin ultraviolet A. Now, we'll see how absorption of UV rays in the body. So, UVC is absorbed in the epidermis along with UVB and UVA may penetrate as far as the capillary loop in the dermis. So, the superficial layer of our body is skin. It is a protective layer of our body. It absorbs the ultraviolet light and prevent its penetration down to unprotected or weak cells. The extent of the reaction or damage depends on the wavelength of ultraviolet and the amount of ultraviolet absorbed. Now, patient's preparation for treatment to ultraviolet therapy. So, first of all, wear goggles, observe and monitor the skin condition, keep skin moisture following exposure to UVR, and pigmentation changes are to be expected and are a normal response. Prolonged and repeated exposure leads to premature aging. Now, physiological effect of UVR. So, we have divided into 2, that is immediate or acute effects and long term and chronic effects. So, the immediate effects are erythema, pigmentation, increased skin growth, vitamin D production, prophylactic effect, immunosuppressive effect, effects on eye. Then long term effects, solar elastosis or aging and cancer. Now, we'll look into all the immediate acute effects. So, first one is erythema. Erythema is reddening of the skin as a result of an inflammatory reaction stimulated by ultraviolet rays, release of histamine-like substance, dilation of the capillaries and arterioles and exudation of fluid into the skin. Then pigmentation or tanning of the skin follows the erythema. Its amount varies with the intensity of the erythema. It is due to the increased deposition of the pigment melanin formed in the basal cell layer of the skin by melanotoblasts and migrate to superficial layers of the epidermis. Now, desquamation or increased skin growth. So, desquamation or peeling is proportional to the intensity of the erythema. Then, vitamin D production. So UVB is able to convert sterols in the skin and such as 7-dehydrocholesterol to vitamin D. Vitamin D is required to assist in the absorption of calcium and phosphorus from the intestine to bloodstream. Then subarachnoid dose of UVB are adequate to promote vitamin D synthesis. Then prophylactic effects. So the resistance of the body to infection is increased as a result of the stimulation of the reticuloendothelial system, antibodies against bacteria and toxins. Then immunosuppressive effects. So UV destroy Langerhans cells and stimulates the proliferation of suppressor T cells, and T cells are regulatory in that they inhibit antibody production. So this immunosuppressive effect may contribute to the development of the skin cancer. In short, UV radiation induces a state of relative immunosuppressive that prevent tumor rejection. Then effects on eyes. So strong dose of UVB and C radiation to the eyes can lead to conjunctivitis and protoretitis, result in irritation of the eye, a feeling of grit in the eye, watering of the eye, and aversion to light. Then in severe cases, intense pain and spasm of the eyelid may be present. This is also known as snow blindness. Then while UVB and C are absorbed in the cornea, and UVA can pass through to be absorbed mainly in the lens of the eye. So the strong doses of UVA may lead to the formation of cataract. Now we'll see the long-term chronic effects of UV rays. So first one is solar elastosis or aging. So prolonged exposure of UVR leads to premature aging of the skin. This is especially so in the fair-skinned, decreases function of sebaceous and sweat glands, loss of elastic tissues, the skin becomes wrinkled, dry and lethargy. The next one is cancer. Skin cancer, basal cell and squamous cell carcinomas. So the carcinogenesis is a danger as these rays may have an effect on DNA and thus on the cell replication. Shorter ultraviolet waves should be avoided and courses of treatment should not be exceed 4 weeks. Now we will see the therapeutic effects of UVR. So first one is psoriasis. It is a skin condition which presents localized plaque in which the rate of cell turnover from the basal layer through to the superficial layer is too rapid. So aim of the treatment is decrease the rates of DNA synthesis in the cell of the skin, thus slow down their proliferation, and treatment can be given using the Leeds regime or PUVA. Then acne vulgaris, it is the skin condition which presents pustules and come down blocking the hair follicles and sebaceous glands on the face, back and chest, an E2 dose of ultraviolet radiation may be given to the patient. Then aim of the treatment is an erythema will bring more blood to the skin and so improve the condition of the skin. Desquamation will remove, come down and allow free drainage of the sebum, thus reducing the number of lesions. The UVR will have a sterilizing effect on the skin. Then eczema. These patients are benefited by mild doses of UVR. Then chronic infections, ultraviolet radiations at high doses are helpful for the treatment of chronic infections, and E4 dose can be used for this. Then vitiligo. One evidence suggests that topical glucocorticoid and Sorolin UVA or PUVA or narrowband UVB at a wavelength of 311 nm are effective for the management of this condition. Then treatment of vitamin deficiency. As already stated, the cholecalciferol, the vitamin D3 is formed in the skin by the action of UVB and UVC on the 7-dehydrocholesterol. Exposure to artificial UVR or artificial sunlight is curative for vitamin D deficiencies such as rickets, osteomalacia and senile osteoporosis. Then protection for hypersensitive skin. Persons who work outside in the strong sunshine region can have reduced effects of sunburn. Then hypertension, then subarachnoid doses of UVB reducing blood pressure. Then pruritus due to uremia in patients with chronic renal failure also shows result when treating using subarachnoid doses of UVB. Now we will see the contraindications of UVR. Irradiations of the eyes, then skin cancer, pulmonary tuberculosis, cardiac, kidney and liver diseases, systematic lupus erythematosus and fever. Precautions to be used of UVR with patients taking photosynthesizing medications, photosensitivity, recent radiotherapy until the effect of the prior dose have disappeared. Then dangers of UVR: burn, premature skin aging, carcinogenesis, damage to eyes, adverse effect due to PUVA. Now we have come to the conclusion. So ultraviolet light therapy has been used for centuries to help in the treatment of many skin conditions, disorders and diseases. While exposure to excessive UV rays can be harmful, and it is important to protect our eyes and skin with appropriate sunglasses and sunblock. Specific amount of UV light can be prescribed for various medical treatments. Whether UV light is natural in the form of sunlight or artificially created through medical devices, it can be used to treat psoriasis, neonatal jaundice, skin eczema, acne vulgaris, persistent itching, vitiligo, treating hypertension, treating vitamin D deficiency or recovery. How will recover from any treatment which we have taken of UVR? So the key to success is complying with the treatment plan prescribed by a doctor. It usually takes about a dozen UV light therapy sessions to achieve adequate results. Once the condition has improved, patients may switch to a less frequent maintenance schedule instead of the daily sessions. In some cases, maintenance therapy can be administered through home UV units. So, I hope you understood the concept of ultraviolet rays, its importance and implication, its indications and contraindications. That's all for today. See you next time. Thank you.